Hi, my name is Michelle Ginsberg. I'm a radiologist and I'm Director of Cardiothoracic Imaging and Vice Chair of Education at Memorial Sloan Kettering Cancer Center in New York City. Distinguishing separate primary lung tumors from intrapulmonary metastases is actually a challenging dilemma in clinical practice. Distinguishing whether additional nodules in a patient that has lung cancer represent either primary lung carcinomas versus intrapulmonary metastases is quite common and very challenging, and the implications for disease staging and patient management are significant. For example, a patient with separate primary lung cancers will have each lung tumor staged separately. So if there are 2 or 3 tumors, one could be stage 1, stage 2, and the prognosis will depend for each one based on the highest stage. Well, if you have intrapulmonary metastases, they're staged as a whole, and that in itself is stage 4. So generally, this is a very important issue that needs to be differentiated. Now, can we characterize the differences in appearances between these two categories? Well, it's not, there are no clear-cut characteristics that go only with one pathology versus the other one, but there are certain generalized categories, and that can help lead clinicians into from the radiologist aspect into considering the tumors as separate primary lung cancers versus intrapulmonary metastases in those where, for example, next generation sequencing is not widely available. Now that we do have more genomic sequencing, which would be the gold standard, that would be the most accurate way, but that's not often available. And but it will help us with characterizing, and then if we can use next generation sequencing to categorize it even further, that will help us select which characteristics may go along with one over the other one. Now, we do know that certain tumors, for example, pure solid tumors, are more likely to be metastases, whereas if you have something with a subsolid consistency, and what I mean by that is a nodule that has dense solid component, but also some ground glass, just like it sounds, component, those are more likely to be primary lung cancer, because this subsolid consistency is more often associated with primary tumors. Now, are there, can we describe spiculated and discuss other words to describe lung tumor findings? Well, spiculated and the contour of a tumor is also helpful in leading one to suggest maybe a primary lung cancer over a metastasis. So in general, when we think of spiculated, just like it sounds, it has spicules, and it's more often seen in the solitary, separate primary lung cancers than a metastasis. As I mentioned, metastases are more likely to be solid, and we think of them as round, more well delineated. Now, lobulated contour can be associated with both types, so that's not very helpful. So in general terms, yes, spiculated, you think of more of a primary lung cancer, while a well-circumscribed nodule will be more likely a metastasis. But there are definitely exceptions and many cases where these two categories overlap. And really, at the end, the gold standard would be the genomic profiling. But if it's not widely available, as a radiologist, we do have a role to suggest that in an individual, if we see multiple lesions, that they could be separate primary lung cancers, and it's not all metastatic disease, giving the patient the benefit of doubt, because staging each of those nodules as a separate primary would give the patient a better prognosis. And it certainly will also change the treatment planning.